Okay, so we got the introduction out of the way. Thank you for still being here. So let's talk just briefly about the benefits of ISTM, Instrument Assisted Soft Tissue Mobilization. I won't get too deep in the nitty gritty because I highly encourage patients, family members, and clinicians to educate themselves and be educated by any of the companies out there. I particularly chose Hot Grips because of the quality of education and tools they provide. Now, the benefits. They are seen by patients, by clinicians, and by facilities. Briefly, facilities on insurance levels, reimbursement has become more and more difficult, and the stress to facilities um, for production has increased exponentially over the past few years. Now, unfortunately, this has turned many facilities into what we call assembly lines, where they crank patients in and out as fast as they can while still trying to give the patient optimal treatments. What I like about ISTM is I can perform the manual therapy that a patient needs in half or less the time than if I just used my hands. Now, that doesn't mean that you can't use your hands or that you shouldn't use your hands. By all means, please continue. But I can get the same, if not better, benefits in half the time. So, from a facility perspective, that means that I can care for patients better in less time, so I don't feel like I am rushing through a treatment, and the patient doesn't feel like I'm just trying to get a paycheck. Now, from a clinician's perspective, for one, I always recommend to be educated properly. It is not optimal to get a tool and start treating patients without having some sort of training. It's not just taking off a rock from the street and scraping at your elbow because it hurts. What I like about it from a clinician's perspective, being a clinician, is it kind of guarantees career longevity. So imagine if you're doing 8 hours of manual therapy 5 days a week, umpteen days per year, because I can't do math that quickly, that can really wear on your hands. The tools like these let me address very specific issues, global issues, as I mentioned before, without really any wear and tear on my hands. I have no cramping, tired feelings after I've treated a patient with these, where I don't know if you've ever given a massage before, if you're a clinician, if you've done a full day of soft tissue mobilization, your hands might be a little sore afterwards. From a patient perspective, kind of as I mentioned earlier, I am able to give the patient that manual therapy that they need, of course, in combination with strengthening, flexibility, exercise, etc. Instead of feeling rushed, the patient would feel more valued and is there getting what they need. Some physiological benefits, pain reduction, so analgesia, it can be used to reduce edema, either directly or indirectly. As mentioned before, it acts as a restart button. So if you have scar tissue built up from a previous injury or chronic injury even that is causing musculoskeletal dysfunction, maybe making you walk a little funny, these tools can help restart the healing process so that your body has a chance to heal properly, be lined up correctly. Of course, like I said, with the combination of exercise and other maybe forms of intervention that your physical therapist, chiropractor, or occupational therapist prescribe. The following videos, I will go over some demonstrations on common diagnoses such as plantar fasciitis that will demonstrate, if you will, the purpose as well as the means of treating such disorders with these tools. A very important thing to remember is that you don't just want to treat the site of pain, as I mentioned before, but you want to treat the kinetic chain or movement on a global scale, because if you bump your foot, you're going to start to walk funny or limp. And if you limp, well, that might make your back hurt. It's like a domino effect. So things like this, ISTM can help address everything all at once, which is phenomenal to the patient, clinician, and the facility.